Welcome again, everyone. I'd like to welcome you to our 11th annual Public Health Speaker Series. I'd like to bring your attention to our Zoom recording policy. So if you take a moment to read our recording policy, and again, we are waiting for many of our participants to continue to log on, and at 5 after the hour, we will begin our presentation.
It's so good to see people from all over the country, primarily the Bay Area, but I see people from Delaware. Welcome, Delaware, Washington, D.C., which is where our guest presenter is coming from, Dr. Bode. So glad to have you on, 8 o'clock your time. We have people in Richmond, California, OC, California, Orange County. It's so funny how Orange County just uses their county as opposed to the name of the city, but it's the county. I always love that. And of course, here in Vallejo, Fairfield, and I am joining you today from San Jose. I will be attending the Northern California Innocence Project Awards dinner this evening, immediately following this presentation. So looking forward to that. And I think, Dr. Wilson, I think we're probably ready to kick this off.
Yes.
All right. So good evening, everyone. Welcome. Hold on. I know Dr. Wilson has given you, okay, here we go. Welcome to the second webinar of our 11th season of the Touro University, California Public Health Speaker Series. My name is Gail Cummings, and I am the director of the Public Health Program, and I am joined by Dr. Wilson, Dr. Deirdre Wilson, chair of the Community Action for Health concentration, and together we coordinate this and host this series, which also serves as a course for our public health students. For more than a decade, this series has brought in national experts together to address timely and complex issues affecting community health. And this year's features 4 distinguished speakers who will explore 2 critical themes that are very timely. First, the rise and impact of misinformation and disinformation on public health. And the second, health experiences of newcomers in today's political climate. Our keynote speaker today is Dr. Letitia Bode, who is a professor in communications, culture, and technology from Georgetown University. She is going to follow up where Dr. Joe Pierre left off with a conversation about the spread of misinformation online and its consequences for health. These conversations really remind us that this work of public health has not only become urgent, it is necessary. Disinformation is not only confusing, but it's extremely dangerous, especially for vulnerable populations, and puts us all at greater risk. At the same time, local policies continue to directly shape health and well-being, and change often begins really at the community level, where the impact is felt most immediately. This year's theme, Navigating Uncertainty, Public Health in the Face of Misinformation and Transition, really challenges us to bring and maintain momentum and continue to advocate for the well-being of women, marginalized communities, and really those most at risk. Before we begin, I want to just take a moment to ground us all wherever we are, whether we're in Delaware or we're in Marin County. We are all on stolen indigenous lands where entire civilizations, languages, and knowledge systems once flourished and do continue to this day. As we gather here to talk about misinformation and how it shapes public health, it feels especially important to honor indigenous traditions of truth-telling, community care, and collective well-being, and those values that remind us what honest, healing communication can really look like. We also want to remember that this country was built on the labor of enslaved Africans, and we honor the ongoing strength and contributions of their descendants. And we recognize immigrant, trafficked, and undocumented workers whose labor continues to sustain this country and our health systems every day. So as we move into today's conversations, let's really hold these truths with care by asking how we as educators, students, practitioners can use what we learn to promote health, to promote truth, equity, and accountability in our classrooms, in our clinics, and in our communities. So thank you for listening, and thank you for being here today, for joining this important conversation. And now I'd like to turn it over to Dr. Wilson.
Good evening, everyone. I'm going to share my screen again. I'd like to conduct a little bit of housekeeping this evening. The public health program at the Touro University, California offers a master's degree in public health to students seeking independent MPH degrees, as well as students seeking dual degrees in public health and medicine across 3 concentrations, including global health, community action for health, and our health equity and criminal justice, of which we are currently the only accredited MPH program to focus on the impacts of mass incarceration and justice involvement as social determinants of health. So if I can direct our students to the slide that's currently visible. This is a course, as you all know. It is a required course. We'd like for you all to, and it is required to attend all sessions using your unique login code. Also, complete the speaker evaluation at the conclusion of the session this evening. I'd also like to remind you all that you are not required to sign up for continuing medical education credits. That is for our professionals who are seeking to use this opportunity as to gain credits for their licensure. So our roadmap for this evening, today's presentation is an overview of the spread of misinformation and its unique consequences for health. We will have a brief question and answer session after the presentation. You may submit questions using the Q&A function in Zoom. And the CME credit slides will follow, but I've also placed the information in the chat several times. So if you could please go to the chat and also let me know if you have any challenges registering for CME opportunities. So continuing medical education is offered through our College of Osteopathic Medical program. It is designated as a live activity, so please register now at the beginning of the session. And here's the code. I'll pause for a moment while you either take a picture of the QR code or log in or text. I'd also like to remind you all that we do offer a micro-credential and badge. A badge is offered for this particular activity. If you're interested in earning a digital badge for your participation in this year's speaker series, please register, not at this link here, but at the link that is in the chat. We also offer a micro-credential in our criminal justice concentration. And it is a select number of courses that we offer. And also, as a reminder, our podcast is up. So if you want more insights from our speakers, please subscribe to Public Health Perspectives for Change and explore the extended interviews with guests from previous sessions and from this year's sessions. So now I'd like to introduce Dr. Leticia Boyd. She is Provost and Distinguished Associate Professor at Georgetown University's Interdisciplinary Communication, Culture, and Technology Master's Program. Dr. Boyd's research is at the boundaries of political communication and media and technology studies. It tackles important contemporary issues such as misinformation, as in her forthcoming book, How to Correct Misinformation on Social Media, which is co-authored with Emily Braga. Dr. Boyd is co-author of Words That Matter, How the News and Social Media Shaped the 2016 Presidential Election, and co-editor of the collected volume Studying Politics Across Media. Her publications have appeared in leading journals like Atlantic Journal of Communication, Mass Communication and Society, and New Media and Society, among others. And as chapters in a number of, and also has chapters in a number of edited collections. Dr. Bode's work has been recognized with a Young Scholar Award from the International Communication Association, the American Political Science Association's Walter Lippmann Award for the best article in the field of political communication, and many other accolades. In 2015, she was named Copenhagen's Center Fellow by the Lillian Lodge Copenhagen Center for the Advancement of Women in Communication. In 2019, Dr. Bode was appointed a Provost Distinguished Associate Professor at Georgetown University. There she also serves as affiliate faculty at the Massive Data Institute and in the Department of Government. So I'd like to welcome Dr. Bode to continue the conversation with us this evening and letting us know how misinformation shapes and changes public health. Thank you, Dr. Bode.
Thank you so much for having me, and what a nice, warm welcome. Let me get my slides up before I go crazy here. Great. So I really appreciate the introductions from both of you because I think they set this talk up really well, especially thinking about the importance of community and the way that culture and background influence the way that we interpret information, communicate information, which is a lot of what influenced this work and influences how we all process information, whether it's true or not true. So I'm going to talk a little bit about the relationship between misinformation and public health, but I'm actually going to talk a lot about what we can do about it, which is the subject of the book that just came out in July that was alluded to in the introduction. So this is mostly going to be the shortest version of a not short book that I can pull together to give you the kind of TLDR version. And hopefully you'll come away with some new ideas and maybe more questions than you started with. So to dive in, I will start with the idea, which is what is kind of motivating this whole series. Sorry, I'm just hiding my floating controls so I can actually see my own slides. There we go. Which is this idea that misinformation is a concern, that there's a problem with misinformation circulating or misinformation being believed by a large number of people. And I have to have a caveat on this slide because there's significantly less concern, at least from elite voices in the current moment, about misinformation compared to recently. But you may have seen, this came out, I'm going to say like 5-ish years ago, the U.S. Surgeon General advisory on, they called it building a healthy information environment, but it was all about health misinformation and how that's a problem for public health. There are other aspects of this as well. The WHO obviously did a whole lot of work on infodemic, what they call infodemic, so concurrent with the pandemic. The global epidemic of COVID-19 was also an information epidemic, which they call an infodemic. And this is something that they've really poured a lot of investment into since that time, a realization that the information environment is as important as the actual public health and epidemiological perspective in controlling pandemics. What people know about them and what they believe is equally important. And then we also have this from a non-public health perspective, but thinking about it from a national security perspective. So the ability of other countries to infiltrate our information environments is also of great concern. And I'll pause there to say that we are very convinced in very limited circumstances that misinformation plays an important role in public health. I say in very limited circumstances because it actually turns out to be a relatively complicated chain of things that has to happen between being exposed to a piece of misinformation and actually acting on it in a way that contributes or discourages public health. So the relationship there is roughly you're exposed to misinformation, you choose whether to believe it or not believe it. If you believe enough pieces of misinformation, that eventually updates your attitudes about that issue. And if you update your attitudes, that can, but doesn't always, affect the behaviors that you engage in related to those attitudes and related to that issue. And those behaviors can, but don't necessarily, contribute to your personal health, which then can, but doesn't necessarily contribute to public health. So it's a very complicated kind of causal chain. And different pieces of research are successful at demonstrating different pieces of that causal chain, but it's very complicated to show kind of from the beginning to the end, which is why we have a limited number of cases where we can actually say with confidence that misinformation is playing a key role in public health. But that's not to say that it's not playing a role, it's just that it's a really hard thing to measure. And I think the other way that misinformation can play a role in public health is just by giving people confusion about what to believe. So it's not necessarily that they do believe misinformation that they're exposed to, but it just becomes more difficult to know what to do in general. Whereas in a hypothetical environment with no misinformation, because obviously that environment doesn't exist and never has. There's always been misinformation and there always will be. In a hypothetical environment where there is no misinformation, people would have 100% confidence in the information that they're exposed to and be able to act accordingly on that information. It's also worth noting here that people only use information as part of their decision-making process. A lot of the way we make decisions is based on emotions and ethics and other things related to persuasion that have nothing to do with information. So even if we could quote unquote fix the misinformation problem, information is only one way that people make decisions. So big caveats to all of this, but in general, people are kind of worried about misinformation, and that is especially true about social media. So people are, I think social media tends to be an easy scapegoat for misinformation. And as I said before, misinformation has always existed and it's not going anywhere. But I think it's very easy to see and understand how misinformation spreads on social media in a way that wasn't always clear before those platforms were available. So what I like to tell people is, if you imagine a world even 100 years ago, let's say 200 years ago, let's be generous, the vast majority of people got information from other people that lived in close proximity to them. Most people didn't have access to any kind of mediated communication like newspapers or other news media, which meant that most of your information was coming from like your neighbor. And no offense to your neighbor, but they're probably not actually that reliable of a source of information. And not only that, you didn't have the capacity that we do have now to actually dig into information that you've been conveyed via social media or via your neighbor or via wherever. Having this, the world at your fingertips to be able to verify information is a very new phenomenon, and one that I think that we underestimate how important that is. Anyway, that's also another little tangent, but all of that's to say, social media is often blamed for misinformation. So to think about why, I thought we would use another conveyor of misinformation and mostly unintentional conveyor of misinformation and ask a generative AI bot what it knows about misinformation on social media. So I asked ChatGPT, and it actually gave a pretty fantastic response. So the reason that social media platforms are distributors of misinformation is because they reward engagement over accuracy. So the way that algorithmic curation happens on social media is all of the inputs are generally based on different forms of engagement, like liking, resharing, spending more time with content, all of those sorts of things. they don't actually measure accuracy at all. So that can't even be an input that goes into the algorithmic curation. They could measure accuracy, but they intentionally choose not to. It's worth saying that. Obviously, they enable rapid and wide distribution of content, so anyone can share, and it gets shared immediately. There's no delay. It lacks traditional gatekeepers, so nobody is going to keep you from saying something or making a particular claim, with very few exceptions. There's very little content moderation on most social media platforms, now more than ever. And it uses these algorithmic feeds that optimize on engagement, that often prioritize emotionally charged or sensational content. So one thing that you'll see a lot of is that misinformation often goes hand in hand with very emotional and sometimes hyper-partisan content. This is all content that is trying to play on your emotions, get you angry, get you scared, and then take advantage of that emotional state to then offer you misinformation that in a different emotional state you might be more likely to reject. But what my book suggests is that social media is not only a net harm with regard to misinformation spread, but can also help reduce the impact of that misinformation. So this book just came out in July. It took us 5 years to write. It was a terrible process. I will never write a book again. It wasn't a terrible process because like the book itself is great and I love it. But it turns out I'm not a book writer. And also both me and my co-author had babies during that time. And also you may have noticed that there was a global pandemic during that time. So it was kind of, we needed a minute to get this book done. But the premise of the book is this core concept that we call observed correction. So that's what I'm going to focus kind of most of the rest of the talk about. Observed correction requires 3 things. So first, it requires a direct response to a claim, specifically to a misinformation claim. And I'm going to walk through each of these. Second, it requires accurate information to be part of that response. And third, it requires that that response and the original post are publicly viewable. So let me talk about why each of those are important. The first requirement, direct rebuttal, is kind of the nature of a lot of not all social media platforms, but a lot of social media platforms have this affordance where content is threaded. So there's an attachment. There's like a piece of string, you can imagine, attaching replies to the original content that they're replying to, which means that you get to see both simultaneously. And this is different on different platforms. Some of them, so like you can see, this is Reddit, which is a kind of message board style platform, but it does change which comments are visible depending on different settings and different engagement with those comments. So you can see that there's 500 replies to this particular post, and you're seeing, 2 of them on this particular thread. But you can see that the second user here, Aramaru 1837, is replying to the original user, Lunar 1314, about his opinion about, I'm assuming, I shouldn't assume gender here, about their opinion about the best songs in video games. Obviously, that's not necessarily misinformation and that's not necessarily a correction, but it is a threaded response. So it's a direct reply. The second requirement of observed correction is that that direct reply has to contain accurate information. So it can't be correction if it's not accurate. I think that's fairly obvious. So in this example, that's not a correction because it doesn't contain accurate information. This is just people fighting on the internet, which is, a surprising amount of the internet, but doesn't mean that it constitutes observed correction. But there are lots of instances in which this does happen. So in this case, this is some misinformation. You can see at the bottom being shared by America's Frontline Doctors, which is a fairly notorious purveyor of misinformation. In this case, they are saying that the HPV vaccine does not reduce cancer rates and that it may increase cervical cancer rates, which is foundationally untrue. And then you have this reply at the top. Again, it's threaded. In this case, it's on Twitter, and this is a quote tweet. So it's a different method of threading, but it's still maintaining that visible connection. Saying that this isn't true and that the HPV vaccine does prevent cancer, and giving statistics to that effect. So it contains accurate information in a direct reply. The third requirement of observed correction is that somebody has to witness it. So I may correct somebody in my house. Maybe I have a visitor, my next door neighbor comes over, and she says something about DC traffic laws changing. And I say, oh no, I read, something and that's not actually true. That is correction. It's a direct rebuttal and it includes accurate information. But if it's just her and I in my living room and nobody else sees it, then it's not observed correction. So the observed part comes in when there are witnesses to that exchange. And again, social media is set up in a way that really facilitates witnesses. There are lots of networked interactions on social media where interactions between people are very visible to a large number of other people. So anytime you see some conversation between other people, that gives you an opportunity to observe any correction that happens in those interactions. And this is my favorite example of observed correction in the wild. This was very early in the pandemic. A gentleman in Texas was saying he was going to make some hand sanitizer. This was when you couldn't find hand sanitizer anywhere. And he said he would make some hand sanitizer out of his favorite Texas brand vodka, Tito's vodka. And to their credit, the vodka company, which he tagged, which is also a social media affordance that allows for this kind of interaction, responded saying that you can't make hand sanitizer out of our alcohol because it doesn't have a high enough alcohol content to be effective at killing germs. So they do totally best practice here. They give you additional information. They link to a credible source, or what used to be a credible source, the CDC. And again, the important thing is that I, even though I didn't follow that gentleman and didn't follow Tito's vodka, was able to see that. So there were witnesses to that interaction, making it observed correction. And there are lots of examples of this. So Tito's is one of my favorites. This is an example from Twitter where somebody's claiming if you increase the minimum wage too high, then you're going to have really expensive burritos at Taco Bell. And somebody says, I live in DC, the minimum wage is already that high, and the most expensive burrito is $3.79. This is an example from my very active neighborhood listserv. There was a dramatic debate about 5 years ago about putting in bike lanes in the neighborhood. And there were people that were very pro and there were people that were very con because it was going to take their parking away. And this original poster was claiming that just because you build bike lanes doesn't mean anybody's going to use them. And the response links to a peer-reviewed study and says that they've actually studied this. And when you build bike lanes, it increases the number of people that ride their bikes. So observed correction happening even in the contentious neighborhood fights. There ended up being a compromise and they made some bike lanes, but not all the bike lanes. So the big question about observed correction, now that we kind of know what it is does this matter? So for those witnesses that see other people being corrected, so some, person A posts misinformation, person B corrects them, and person C watches. What happens to person C's attitudes? Do they become more accurate because they believe the correction from person B? Do they become less accurate because they saw the misinformation in the first place and maybe they would have been more informed before they saw the misinformation? Or do they become just really confused because they're seeing, one person said this and one person said that? And it's worth noting that we did a bunch of interviews with social media users, about 32 social media users, and they said, for the most part, people were very skeptical that this would work, that this would be effective at changing people's attitudes, or what we call belief accuracy. So you can see this participant, who we call Lisa, says, I know all these people are not going to believe me, and they're going to attack me and stay with their own little group. What's the point? Let them think what they think, even though it's wrong. I'm not going to be able to change their minds about it. So there's this pretty substantial belief that correcting is not going to change anybody's mind. And she's talking both about the person that posts the misinformation, but also the other people that see that interaction. So to test this, we have 8 different data collections, totaling, I think, 24 conditions over a period of 5 years. And for each of these, there are different things about each experimental collection in terms of who's posting the misinformation, who's doing the correction, what the source of the correction is, whether there's a visual or not, whether the tone is positive or like empathetic or kind of rude or neutral. We test this on different platforms, including Facebook, Twitter, Facebook Live, Instagram. We test this on different topics, including the Zika virus, COVID, raw milk, genetically modified foods, some other ones that I'm not thinking of right now. We test this on different samples of people, and we also test this over time, obviously. So lots of different data collections, and I'm happy to talk about specifics of any of those things that we manipulate. But across all of them, the format is fairly similar, that everybody is seeing a simulated social media feed of some sort. And some of the people see nothing, or see just neutral posts. Some of the people see a misinformation post with no responses to it. Some of the people see a misinformation post with correction, and then we see the difference between those different groups. So this is kind of an overview of what all those studies together look like. And the y-axis here is percent change in accuracy. So the higher those bars are, the more accurate the witnesses to the interaction become after seeing the interaction. And you can see these are not huge effects. The outlier here is raw milk, where people were much easier to convince of the correction than other things. We attribute that to the fact that most people just don't know that much about raw milk in the first place, although that may be changing as it becomes a more political topic right now. And then the other outlier that is the only negative bar on the chart is the one time that we tested Facebook Live. So you can see that on this slide. That woman in the blue jacket is claiming to be a medical doctor. So she's a very credible source. She's saying crazy things, including that sunscreen will change your DNA and give you cancer as a result. And the corrections are coming from Facebook Live comments, which if you haven't gone on Facebook Live, which I think it's mostly a dead platform at this point, they kind of scroll. It's some of the like online shopping platforms are like this too, where they have scrolling comments that kind of go through the video. These don't go through the video, they go on the side, on the right-hand side of the video. And we think what happened is essentially like the video was too compelling and people didn't pay attention to the comments. And we actually had a post-test question where we asked people if they could tell us what the comments said. And only about half of people said they saw the comments in that question at all. So they were just too focused on the video. So it's an interesting thing to think about from a platform perspective, is like, if you're going to engage in correction, where are you going to get the most bang for your buck? Maybe not on Facebook Live, where nobody's going to see it. But the overall story here is a fairly consistent one, that seeing somebody be corrected makes you more accurate on average. So given that, we wanted to think about who does corrections. We have various sources of data from computer scientists showing correction in the wild. So like mainly using Twitter data, how often do people correct one another? And who are those people, and what happens next, those kinds of questions. And it's a minority of interactions, but we would expect it to be a minority of interactions, given that most interactions on the internet don't necessarily contain misinformation or even a factual claim that could be true or false. But we wanted to know more about who was willing to do this and who was not interested in doing this, and what does that mean? So we start from this perspective of thinking about the information ecosystem and the major actors in that information ecosystem, and we call these the 5 Ps. So we have social media platforms, policymakers that make rules or laws about the way people interact in society. Professionals, in this case, we're talking about public health communicators. The press, we are dealing mostly with fact-checking journalists in this case, but all journalism would exist in that bucket. And then the public, which is mainly like users of social media or, potentially non-users of social media, because observed correction can also happen in offline spaces. So to start, we ask whether experts engage in this kind of correction. And in this case, we're looking at both professionals and the press because we interviewed them separately. We had about a dozen of each, but it turned out their motivations were very similar. So we kind of talk about them together. And the answer is mostly no. So if we go back to the requirements of observed correction, professionals and the press were very likely to endorse accurate information. That's kind of their entire job, is to communicate accurate information to the public, and to do so in public. They don't do it in private, so they had no problem with the witnesses requirement. The thing that they were hung up on is the idea of direct rebuttal. So they were very eager to broadcast accurate information to the public, but did not want to do so in a direct way with regard to people that were posting misinformation online. And they had really good reasons for this. So the main reason was that they, almost to a person, had been targeted with attacks, even without directly rebutting other people, and especially when they did engage in direct rebuttal. And some of these attacks were quite nasty, and sometimes even included threats and in-person threats and all kinds of horrible things. So for that reason, they did not want to engage in this kind of behavior. What they did want to do is promote accurate information. And we really talk a lot in the book about how important this is in addition to the act of correction, because you need to have information available that is accessible, curated, and reliable in order to be able to engage in correction effectively. So people use what we call ACE, accessible curated evidence, to make them more confident to correct, to know what's true or what's not true. And it also makes corrections more effective if you're including accessible curated evidence in them. So going through that process of professionally curating information for people and making it available and easy to understand is a really important aspect that professionals in the press do. So, okay, professionals in the press don't want to do this, but that's fine because we have other people in the ecosystem that could also be engaging in correction. So our next question is whether members of the public correct. So to engage in this, we interviewed a bunch of social media users, and also did a bunch of surveys as well. And the answer is, unfortunately, once again, mostly no. So for members of the public, they were fine engaging in direct rebuttal and often felt that they had the accurate information they needed, but they did not want to engage in correction in a public way. So people would tell us, if I'm going to correct somebody that I see post misinformation, I'm going to DM them, I'm going to send them a text message, I'm going to call them and be like, hey, you shared something and I think you should take down, as opposed to posting that in direct reply to the misinformation, because they were afraid that would humiliate or embarrass the person. And again, people had stories of, my friend stopped talking to me after I did this, or, it ruined my relationship. So they, most of the public generally endorses the value of correction. They say that people should do this, that it's, good for people to correct misinformation when they see it, but they're very careful about the way in which they do so, which is not necessarily a bad thing. It just means we're going to have less supply of public corrections to facilitate observed correction. So given that members of the public were not terribly eager to correct, we wondered if we could motivate people to engage in correction more. So we did an experiment that was meant to look like kind of a Facebook banner ad that showed people a variety of messages that were related to the reasons that people told us that they wouldn't correct in the interviews. So some of these were about how effective they thought it would be. Some of these were about social norms of whether they thought it was okay to do or whether they thought other people would do it. Some of these were about fears of being attacked. So different groups of people got different messages, and then they each got a series of 6 posts that they said whether they would reply to them or not, and if so, what they would say. And in one of those posts, it was that same claim from before that sunscreen changes your DNA. And we're measuring here if they said that they would reply with correction to that misinformation or not. So on this graph, you can see the green bars are statistically significant and the blue bars are not. So the control, which is the group that didn't see any message at all, is on the far left. And that's kind of what we're comparing to. So that's kind of our baseline. So there's 2 groups here. One is how effective you think engaging in correction is going to be. Sorry. Oh, I thought I was going to sneeze and then I didn't. Okay, one is, do you think it would be effective at correcting the person that shared the misinformation, which is on the left? And then do you think it would be effective at improving the accuracy of people that witness it, which is observed correction on the right? And then the second piece of it is a norm aspect. So injunctive norms and descriptive norms. People should engage in correction when they see misinformation, and that people do engage in correction. It is absolutely true that people think you should engage in correction based on our survey research. It is absolutely not true that most people do engage in correction based on both our survey research and on digital trace data. So it seems like what your community is doing and what you think your community is doing is an effective motivator to kind of change the way that you think about correction and your role in that correction, in addition to whether you think it will be effective. Having said so, it's worth keeping in mind that public speech is somewhat threatened at the moment, and people feel increasingly unable to speak their mind in a lot of cases. So this data is actually only going from 1954. The scale of the years is kind of weird because they didn't do this every year. So, you know, you have to kind of read extra close on that bottom axis. But overall, it's going from 1954 to 2020. And it's kind of the opposite of the way that I would measure this. Rather than how willing are people to speak their mind, it's how unwilling are they to speak their mind, that they don't feel free to speak their mind. So you can see these numbers are going up significantly. And again, this ends in 2020. I would say, if anything, in the years since, I would expect this to continue to rise. So the more that people feel uncomfortable speaking up, the less likely we are going to see observed corrections in the wild, and probably the more difficult it's going to be to motivate people to engage in these behaviors. Now, you may have noticed that I haven't talked about the platforms yet in the 5 Ps. So what about the platforms? In a separate project with a colleague of mine at Georgetown, we did some work including both a survey and some interviews about how people think about misinformation interventions on social media platforms. So almost all of these have gone away now, but until recently, various social media platforms, when they identified something as being misinformation according to their own terms of service, so they defined this internally, they had different interventions that they would put on that content. So not necessarily take it down, but put an interstitial over it or put a warning flag on it or different things like that to give people more information about the content that they're viewing. And we call these automated misinformation alert and detection systems. It's a mouthful. I didn't name it. And we find from our survey data that people generally like these interventions. So most people said they liked them at least somewhat, and a fair amount also said a great deal. There's a small minority that disliked them, and most of the people that dislike them a lot. But when we talked to people, they didn't really know where these interventions were coming from. So when we asked people about this, they basically said they didn't know. Some of them said there's literally a person reading all of the content and deciding whether it's true or not. which is obviously not true. Some people thought, it's all keyword based, and if a keyword gets flagged, then all of the content related to that keyword is going to have these interstitials over them. There was a lot of what other scholars have called the algorithmic imaginary of like trying to make up a story of what is going on behind the scenes, but not really understanding it. So if the point of these interventions is to serve as a sort of correction, give people additional information, it may not be having its intended outcome because of that misunderstanding of what is actually happening. And it's also worth noting that all of these interventions are probably on the way out. So Twitter, Meta, YouTube, Google have all pared back on their various misinformation-related interventions. It's also worth noting, related to the policymakers, that so one of these headlines said that Meta is ending its fact-checking program. Meta until recently had a third-party fact-checking system where content would get flagged internally as being likely misinformation and then go through a process of an external third-party independent fact-checker journalist reviewing the content, making a determination, and then the platform would take action on the content, including downgrading or sometimes removal, but usually not, unless it violated another terms of service. As a result, it ended that project early this year, but it has said that it is only doing this in the US market, not in the European market, because the European market actually has the Disinformation Code of Practice and the Digital Services Act that have requirements related to harmful misinformation that mean that essentially they have to do this from a regulatory perspective. So I think that's a good example of how the different P's are interacting, right? So policy is informing the way that platforms function in different places. So all of this, everything that I've talked about today is very contextual, based on the community, based on the society, based on the culture, based on the politics. And to that point, I think it's also worth keeping in mind, and maybe this is the most important thing I say today if you don't take anything else away, all of the things that we can do to reduce the spread of misinformation and the impact of misinformation are going to be marginal. None of them are a silver bullet that we can just do this one thing really well and all of a sudden misinformation is going to go away, or it's not going to matter anymore, or people won't believe it. So what that means is that we can't just do one of them because none of them are effective enough interventions to only do one thing. So correction reduces or improves people's belief accuracy about 12%, which is better than 0%, and at least it's not negative. But that's not going to completely solve the misinformation public health problem. So much in the same way that we had a Swiss cheese model related to COVID-19 transmission, where we wanted people to wear masks, but also social distance and get your vaccine and all of these various things, because none of them are going to protect you perfectly. But if you layer enough types of protection, then, eventually you kind of catch the virus, so to speak. In the same way, we think we can layer interventions, different types of interventions that are designed to limit the negative impacts of misinformation, to improve the information ecosystem overall. So I will stop there, and I am eager to take any questions that you have.
Thank you so much, Dr. Bo. This is, I'm so glad you ended on the note that you did, as I imagine most of us on this call are. But I think it's really fascinating, and I have to throw my little tantrum, like, why can't we be more like the European Union? So I'll just say that, and I won't say it again. And we say that all the time in public health for many reasons. But what I did appreciate about sort of your, especially how you ended, but the conversation overall, looking at the multiple layers that the reasons that we are even here in this place, there's multiple reasons why, but the multiple layers that are required to address the problem, especially looking at it from a public health lens. The social determinants of health, there's not a magic bullet. There's just, you have to address it from multiple angles, depending
Mm-hmm.
depending on the population. But of course, I will ask you, given that the multiple layers, and looking at all of those different uh, elements that we are required to look at in public health, I still feel, particularly with social media, it's unique. It has a unique place in terms of evolving, because information is evolving. It's really interesting. You talked about the case with the sunscreen, because I remember being so disturbed by that. And a lot of people who are health minded go, well, yeah, there's so many chemicals in sunscreen. And,
Mm-hmm.
because it feels very rational for people who generally, may have, a set of an understanding that they're bringing in, and it's not specifically disinformation from the standpoint of the person receiving that information. I'm rambling a little bit, but um, do you have like one recommendation, like clinicians or public health professionals can take away from?
I mean, I think for clinicians, it's so important to remember that clinicians are actually still very well trusted compared to almost everyone else. So we have seen trust numbers for government, for basically all institutions, for the media, for scientists, even for the military. Like basically everything that we measure people's trust in has gone precipitously down over the last 20 years. Um, Now, it was probably artificially high given the era that we were coming from and when we started doing public opinion polling, and that's a kind of a separate kind of wonky measurement thing. But clinicians, like especially your own doctor, people trust their own doctor to a much greater extent than they trust any of the kind of institutional information they're getting, including like CDC and WHO and all of those kinds of public health organizations. So for the people that are actually practicing medicine, I think that there's an enormous opportunity there to have the kinds of conversations that are going to feel safe and trusted and trustworthy to people that may otherwise be really suspicious of the kinds of information that they're getting elsewhere. So I think that that's a really important thing to keep in mind. Not to like say it's all on you and, pressure's on, whatever, but it's an opportunity.
We'd like to invite everyone that is in our audience to place any questions in the Q&A. And while we're waiting for those questions to populate, Dr. Cummings and I have a few questions that we'd like to get the ball rolling. I think Dr. Cummings already asked one. So I'll go ahead and just go ahead and throw out another. So much of public health communication relies on changing behavior. And so, I mean, that's a big part of what we teach, especially, in the master's program. How can we change behavior? How do we go in the community and not only build trust, but, change behavior based on culture, what's happening. And so, so we really rely on this, right? So public health relies on communication and changing behavior, not just beliefs. And so how do observed corrections shape behavioral intentions? For example, decisions to vaccinate, mask, or seek care?
Yeah, so that's a great question. We don't ask behavioral intentions for all of our studies, but for the ones that we have, it's one step down that line that I was talking about right back at the beginning. So you see a little bit of slippage, the which is to say the effect on attitudes is bigger than the effect on behavioral intentions, but it's still consistently there. So I'm trying to think what the studies are that we ask this, and I know that one of them is raw milk. So we ask people if they would drink raw milk, if they would eat raw cheese, and if they would give it to their children, if they have children. And then for genetically modified foods, we ask people if they if they would consume genetically modified foods, if they would seek additional information about genetically modified foods. And I'm trying to think there's another one, which I think is, yeah, I'm not going to come up with it right now. But yes, so the behavioral intention part is super important. It is a little bit, yeah, downstream from the other stuff.
Okay, great.
Oh,
Thank you so much.
yeah, and we do have a question in our chat. This is from a student, Annabelle Gutierrez. Hi, Annabelle. I've come across several social media posts where clinicians, such as MDs and DOs, have spread misinformation on the internet due to their personal beliefs. Do you have any tips on dealing with these types of clinicians if we were ever to come across this in person or when reaching out to our own providers? It's an interesting question.
I think this is a really tough question because, well, there's a couple of reasons. So one is when you're dealing with a person that has inherent expertise. So in this case, as a result of being an MD, it's going to be an uphill battle to find corrective information that's going to be persuasive to the audience that's witnessing that, which I think is the same thing that we saw in the Facebook Live video, where it's a medical doctor that's making the misinformation claim in the first place, in addition to the fact that people didn't see the comments. So I think that's one reason. The other reason is I think it's worth keeping in mind that different people have different motivations for sharing misinformation in the first place. And some of those people are likely to be more amenable to accepting a correction or at least not getting into a fight about it. And other people are going to have motivations that would actually have the opposite effect. So I think particularly when you have someone who has the expertise to know what's true, but is choosing to share information that's not true, as you kind of alluded to in your question, Annabelle, they have other motivations that are probably more important than the actual factual accuracy of the claim that they're making, which means it's going to be harder for them to accept a correction, which doesn't necessarily mean that other people won't be impacted by seeing that interaction, but you also have to kind of weigh your own personal tolerance for potentially being attacked or getting into a back and forth with somebody like that. So I don't have a great answer for what exactly to do in that situation, but obviously it's unfortunate when we have medical experts that are not sharing good information.
So we have another a student question, or it looks like anonymous attendee question. And so this goes to the COVID-19 pandemic. And it says there was medical misinformation kind of skyrocketed during this period of time. So we all are familiar with that. To rebuild trust, acknowledging the problem is the best way, this person's opinion. Do you think the medical community owes the public an explanation or more attention to what happened? So in order to, I guess, rebuild trust, do you think that is a way to rebuild trust?
So I do think that trust is at the core of a lot of these conversations. Again, if you have a set of institutions or individuals or organizations that you trust that are also disseminating accurate information, we're less worried about all of the other noise on the internet. So the fact that trust has gone down in so many institutions and purveyors of accurate information is part of why misinformation on the internet becomes a bigger problem, because if you don't have that trustworthy information, then it's easier to be persuaded by whatever you do see. So I think trust is definitely part of that equation. And I definitely think there's work to be done to build or rebuild, depending on your perspective, trust in the medical community. This is a personal opinion, I think, not an empirically based one, but I feel like the medical community did do a very good job of explaining what happened during the pandemic and why they made the decisions they did. And they is like a difficult thing, right? Because there's thousands, tens of thousands, millions, I don't know, of medical professionals that were making decisions, and obviously they weren't all making the same decisions. But I think collectively, I have a good understanding of what happened during the pandemic and what went well and what didn't go well. And so I'm not sure that there's a huge reckoning that needs to happen on that particular front. But I do think that there needs to be a lot of attention, and I think there is a lot of attention right now in the public health community and beyond, thinking about why they are not being seen as trustworthy as they had been in the past and what can be done to change that.
Thank you so much for addressing those concerns and questions of our students.
Yeah,
Of course.
I know, I'm not sure if we have any more questions, but I would love to just, agree with your last sentiment, because I do feel like the medical community and public health community, but there, if we all recall, there were forces, outside of those communities that were at the forefront of that information. So, and I feel like maybe that is also at the other question and what we're dealing with at this point, when our leadership, misinformation is coming from the very top, with the power. And that's the serious challenge that we have in doing this work.
Mm-hmm.
So there are a couple more questions that just popped up. And I think the one is from Andrew Ha, and he's asking if there is research or data on trends of who is more at risk at being targeted by disinformation or more at risk at sharing misinformation. And I think this is really important. It's actually happening.
Yeah, definitely. I don't know about trend data specifically, but in terms of who is most likely to be targeted by disinformation, it is there are a couple of different aspects of this. One is very identity based. So people are very susceptible to misinformation and disinformation when it validates their identity, when it gives them a community to belong to that they don't necessarily otherwise have. So a lot of those people are, susceptible in other ways, vulnerable communities in other ways that are also going to be most susceptible to misinformation. The other thing we know is that from a disinformation perspective, especially state-sponsored disinformation, so internationally state-sponsored disinformation is often targeted at minority communities in the United States, particular. And the other thing I was going to say was, in terms of sharing misinformation, the number one predictor of who is likely to share misinformation is age. So old people really struggle. They did not get the same kind of media literacy training that the rest of us got, and I probably should include myself in old people at this point, but they are not as media literate, and they are more likely to be susceptible to sharing misinformation as a result of that, because they are sharing not based on what they think is accurate, because they tend to just assume that everything is accurate, but based on what they find entertaining or pretty or interesting. And you see this actually a lot with LLM generated visual content, that older people will share things that are clearly like not true and not based in reality. So that is the thing I would say about that.
Thank you. Yeah, they're definite targets, and I think we're going to see more increases in that, especially with the AI generated, images and information that are just so close to looking real.
Yeah.
And, I think as these processes become a lot more sophisticated, I think we're going to have to be aware of, I'd say, vulnerable populations, right? Who would be targeted for this type of misinformation.
Mm-hmm.
or dare I say disinformation, which is, I know that there was a question earlier on about the difference between the two and if we were using it interchangeably. No, we're not using it interchangeably. So misinformation is one thing, but disinformation is more, it's intentional. And so misinformation is sometimes a mistake or a person is misinformed. Disinformation is an intentional misleading of individuals. And there was a lot of that happened during the pandemic as well. So we want to make that we're clear on that.
And just a quick interruption. I'm going to apologize in advance. I'm going to have to log off a little bit earlier to attend an event, but I know there are a couple more questions, so I want to make sure there's time for that. So I just didn't want to say goodbye. And thank you for a phenomenal conversation. And we look forward to talking with you more in our podcast. All right.
Thank you.
Thank you, Dr. Cummings. So we've answered the questions that are in the chat, but I have a couple of more questions. We'll wait for people to populate. Folks are formulating their questions. And so I'd like to know how can we serve as credible correctors when we observe kind of the misinformation that is being that's out there, especially this time of year, right? So right now, we really want to get folks, typically year round, but right now we want to get folks vaccinated with kind of the basic vaccines, right? So flu, COVID vaccine, in order to protect people during kind of the height of this infectious disease season. So how can we be or serve as credible correctors?
I think that's such an important question. And I made my whole family go on their day off last week to go get COVID and flu vaccines. So they were not happy with me. No school, time to go get shot in the arm. So yeah, I think there are different ways to demonstrate credibility. And a lot of this is, nothing that's new to any of you. It all goes back to, what makes for persuasive communication campaigns, which is kind of, at the heart of a lot of what public health does. One is by explaining your expertise in ways that people can understand. So explaining why they should believe you. What do you know about something that is maybe not obvious, but not being condescending about it at the same time. And then the other thing that I would say is evidence, and I think there was another question that popped up about this as well. Does evidence make corrections more effective? Do people need to do their research before they're engaging in correction? And I think 100% yes. And part of that is also going to mean that you can't correct and probably shouldn't correct every single piece of misinformation that you see, because you're not always going to be a credible corrector, and you may not necessarily always have access to effective corrective information. So I think that's important to remember too, is you are an expert in certain areas, and those are totally appropriate areas for you to engage in correction in, and other areas that you don't know anything about, like owning a rabbit or something. I don't know, maybe you don't need to weigh in on that conversation. But I do think the more, and this gets back to the norms aspect of it too, the more that we engage in conversations about facts as if that facts matter in that conversation, that actually changes the way that people think about those conversations entirely. So engaging in correction when you don't have evidence, or at least you're not citing evidence, you're not, sharing evidence as part of that correction, I'm not sure it's still effective. Like empirically, we've done that without, even if you don't share evidence, you just say something is wrong, that still has an impact on people. But I think from a long-term perspective, we need to do more to increase the value of accuracy in the first place. And I think sharing evidence as part of a correction is a really important way to do that, and to make yourself a more credible corrector in the process.
Yeah, I love that, actually sharing evidence instead of just opinion. And so I'm looking to see if we have any other questions. But I think actually that is a really great way to wrap up today's session on misinformation. If we want to be credible correctors, we need to present facts and not think that we have the facts or expertise in all areas. So I really appreciate you spending time with us this evening, especially because you are on the East Coast and sharing your expertise on misinformation. So thank you, Dr. Boat.
My pleasure. Thanks so much for having me. And thanks for all the great questions.
All right. Well, we're going to wrap up this session. Please join us for the next session of the 11th Annual Public Health Speaker Series. Have a good evening.